Good morning everyone. I am M. Pratyusha Raj, working as assistant professor in Aditya Pharmacy College. Today I am going to lecture about Parkinson's disease. Parkinson's disease. Parkinson's disease is a chronic degenerative neurological disorder, which means it affects mainly the neurons of the basal ganglia. So when it affects the neurons, then it causes symptoms like it causes some characters like tremor, bradykinesia. Bradykinesia means slowed movements of muscles, and rigidity and postural instability. That postural instability means the person cannot maintain his or her balance. So next, coming to the clinical manifestations of Parkinson's disease, there are difficulty showing facial expressions, means they can't show the facial expressions clearly, and there is a muscle stiffness because of the effect to the Parkinson's affect the neurons of the basal ganglia. They can get the muscle stiffness, and there is also slowed and affective movements. Movements also can also be affected. And then speech changes, and then tremor means shaking, and especially of one hand. And then dementia means loss of memory, and then issues with the autonomic nervous system such as problems with control movements. Here issues with the autonomic nervous system means they can't do their own actions by they can't control their movements. So autonomic nervous system problems are like they have the problems with controlling their own movements and or spasms. Next, early problems with balance means they can't balance their own body. Next, coming to etiology, there are many causes for occurring this Parkinson's disease. The main cause is hereditary. Actually, the main cause is unknown, but it can also occur through heredity. That means because of the genes. And next, some medications like antipsychotics and antiemetics, and also repeated head trauma. Because of the trauma to the head, means if there is any injuries to the head, that is which are repeated, then this Parkinson's can be occurred. And then certain neurodegenerative disorders. Neurodegenerative disorders, they are like multiple system atrophy or Lewy body dementia and progressive supranuclear palsy. Here in Parkinson's, the main in pathophysiology we can see the Lewy bodies. So these are the certain neurodegenerative disorders which can cause the Parkinson's disease. And next, coming to toxins. Some toxins like carbon monoxide, cyanide and organic solvents can also cause this Parkinson's. And then certain brain lesions, if there are any lesions in brain like tumors or fluid buildup in the brain, it can lead to Parkinson's. And next, metabolic and other disorders. Some metabolic disorders can also occur this Parkinson's. For example, chronic liver failure. Next, coming to pathophysiology, here some antipsychotic drugs or encephalitis. Encephalitis means antipsychotic drugs or encephalitis and other causes which we have seen before. They can affect the substantia nigra. In the basal ganglia, there is a substantia nigra. Because of these causes, there will be effect to the substantia nigra. This leads to the destruction of dopamine producing neurons within the basal ganglia. Here these antipsychotic drugs and others will affect the substantia nigra which is present in the basal ganglia. So in the basal ganglia, it destructs the dopamine producing neurons, the neurons which are producing dopamine. This will destruct those dopamine producing neurons within the basal ganglia. This leads to the reduces the amount of available striatal dopamine. Means because of the destruction, the result will be dopamine inhibitory effects will be reduced. Because of there is a reduced amount of available striatal dopamine, because here neurons are destructing the here these cause are these antipsychotic drugs or others will destructing the dopamine producing neurons. So because of that destruction, it leads to the reduced inhibitory effects. And next, after the inhibitory effects were reduced, there will be an obviously there will be an excitatory effects. Means if inhibitory effects were reduced, there will be excitatory effects. Means why? Because of reduced dopamine, there will be increased acetylcholine. So these excitatory effects leads to the inadequately balanced. This acetylcholine is inadequately balanced because of the reduced dopamine, and this excitatory effects are balanced inadequately. It leads to the difficulty in controlling and initiating voluntary movements. So that's why there will be a difficulty in controlling the voluntary movements. And next here, in substantia nigra, there will be a accumulation of Lewy bodies. The main process is the Lewy bodies will be accumulate and will be seen in the substantia nigra. There will be increased alpha synuclein also. And next, coming to diagnosis, we'll take two types of diagnosis. First one is single photon emission computerized tomography scan, which is called as dopamine transporter scan. In here we will know the how are dopamine are released, or is there any destruction of dopamine neurons. We will observe in this. And next, imaging testing like MRI, ultrasound of the brain, and PET scans. MRI and ultrasound of the brain we will see about the presence of Lewy bodies. Next, coming to pharmacological therapy. Here we use the anticholinergics because it affects the first one we will use anticholinergics and antihistamines, dopaminergics, dopamine agonists, and MAO inhibitors, and last surgical treatments like thalamotomy, palidotomy.